Well, Anthony, it's good to have you in my backyard finally. Usually I'm up in the RDU Ascensus backyard.
Yeah, no, it's great to be here. Had some customer visits nearby, so glad we could meet up.
Good. I'm glad you did. And always curious talking to you about the state of robotics, the state of digital surgery. And one of the two that's a cleared robot in the US.
Yes.
And that in itself has become a PMA. It might as well be a PMA these days. What are you looking at when you think about the landscape these days in robotics? You and I have had very candid conversations about this over the last couple of years.
I think from the landscape point of view, what we are seeing is all the newer platforms that are coming in are picking up, but it's been slow because they continue to compare with the incumbent who's been around for 20 plus years. So including what we have to offer, it's different. It does different things, the cost profile is different, types of procedures you can do is different. So I think there's a bit of adjustment or getting used to. And from our point of view also, we kind of need to highlight saying it's not the same thing that existed. Mm-hmm. It could do some other things, but it does it in a different way. Mm-hmm. So there's, I think, considerable amount of market development and market awareness that need to be built. And I think it's going to be the same challenge for all the other players to be able to communicate their offering, their strategy, which areas of surgery and why, and what kind of problems they intend to solve or benefits or opportunities they hope to present. So it's interesting.
And we're also seeing that robotics is starting to have subsets of interest in it. So, 20 years ago, 15 years ago, 10 years ago, the robot was the thing.
Right.
And now we're hearing differentiation. If I think last count, there was something like 100 soft tissue or thoracic or abdominal robots in development around the world right now. And it's starting to be a little bit less about the robot and more about either, I'm hearing calls to action about single use end effectors. I hear calls to action about form factor differential. I hear calls to action around advisement and console, open, closed. So what are the competitive advantages that Ascensus is continuing to pursue and sees as differentiation?
Yeah. So I think it's a good example, right? All of that, obviously over time there will be consolidation, but the consolidation will take place based on specialty or procedure or value that certain technologies could add. Right? Now, if you think about robotics, I think the thing about robotics is its manipulation. It's manipulation of instrumentation and manipulation of a camera. But what's next, right? That part's been done well, and it's relatively becoming, standard in terms of robotic manipulation. So I think what's next is saying, how do we take the manipulation aspect as a given, and how do you now change the paradigm in terms of outcomes, leveraging software in terms of augmented intelligence, machine learning, etc., all the technologies that are soft, not hard, compared to the robotic elements, to be complementary and assistive and amplify the surgeon and amplify the surgeon's ability and put some guardrails around safety, workflow, productivity, etc. So I think we'll see a shift in terms of the softer side or the analog versus digital kind of difference, where digital would be the software-driven surgery, what we call digital laparoscopy or digital surgery. I think that's going to become amplification, become more prominent, I think, over time, compared to what we are traditionally used to in talking about robotics.
I get a chance, fortunate enough, privileged enough to sit in a seat where I get to see a lot of platforms and I see a lot of form factors. And when we talk about advisement and we talk about insights to a surgeon, I hear the organizations that are not quite cleared yet, whether it's in Europe or here in the US, where they will say, we've got that, but we're not turning it on yet.
Right.
Yet a census has theirs on.
Right.
So
Right.
why are they not turning it on? Is it a clearance? Is it comparative to you or an intuitive? What are your thoughts there?
I mean, I couldn't comment on why or why not others are doing something or not doing something, but I can say that from our point of view, it's a challenge. It's a very big undertaking first to get a robot cleared, and then you add the whole augmented intelligence element in a real-time setting. This is not pre-operative, not post-operative, but intra-operative. Yes, it adds a significant amount of challenge in order to make that technology reliable, make that technology valuable, and get it through the regulators. So it is a pretty high bar overall. And given the number of years we've been working on this, we had the confidence to do it. And I think that's going to be the real difference. I mean, a few weeks ago, maybe a month ago, we did a live surgery broadcast at a congress in Europe, on stage. It was not about trying to showcase the telepresence capability that we have. It's more a demonstration of the confidence we have in our technology to showcase it on stage in one country while the surgery was actually happening in Germany on stage, and we're going to do it again in a few weeks in London, where we are going to do a live surgery broadcast using Senhance. So we have the confidence given the history we have with the product. We know what it can do, the system and the software side of things, and the machine learning capability. So we've built the confidence over the years, which we intend to showcase more and more.
Since you've been there as CEO, you've made some very important decisions. In fact, you've been ahead of where the market ought to be going. And what is it that people still are not aware of when I think of the start of Transenterix, and then you came on as leadership and coming from a very technical background and a very technical imaging CapEx background. The transition from the Transenterix culture to the Ascensus forward-facing culture, you had to make some decisions.
Yes.
And what are people not aware that Ascensus has on their platform right now that they should be considering?
Yeah. So I think we are building the ground floor of the future, which is digital assistants for the surgeon, and also creating or developing a virtual assistant for the surgeon. That could be procedure specific, it could be surgeon specific, or even specialty specific. And these technologies take time. It's not where you can build a robot and test a robot, which you can do, but the augmented intelligence part, you need to collect data, you need to see patterns, then you need to train certain algorithms in order to get the outcome. So we have a very solid foundation. That was the reason why we are in clinical use, because that is the best setting to learn and train the algorithm. So we are globally on the market with the technology. So now we are collecting data and learning from this data in order to offer the solution in the years to come. So you don't see that today. You just see the basic features, measurement, tagging, what can you do when you combine those features. These are more features, but the solutions will come over time as we gather more data, as we learn and train our algorithms. That's when I think the benefits are yet to be seen. But it's a journey, it's a roadmap that we are at the beginning of.
But it feels like it's a
digital surgery flywheel. It's not a linear return on effort, is it? It's definitely not a linear effort, for sure. I mean, it is, once you have a certain critical mass of data, then the apps are going to follow very quickly, right? I mean, pretty much what we already have is, you could say, the iPhone. We don't have a whole lot of apps on it yet. So the App Store is what's being developed, partnering with surgeons and hospitals, trying to understand what's important to them. And then once the apps come in, we have cleared all the regulatory hurdles. Now it'll be incremental changes that will be presented to surgeons through launch of apps. Could be procedure-specific or surgeon-specific tools. Could be either or. What are your thoughts about, we mentioned earlier in the conversation, the single-use strategy? Yeah. Years ago, there are some legends in the industry who said, not possible. That seems possible now. The form factor. There are platforms out there that have a smaller form factor, and that's their competitive advantage. Right or wrong? What do you think about when you look at all those options in the field in digital surgery now? So I think technology has evolved. All the manufacturing processes have evolved. The materials have evolved. So as a result, you can do things differently. You can make things smaller. You can bring costs down. So I think those are all technologies that will be developed and enhanced and advanced over time. And I think whatever that we said is not possible 20, 25 years ago can be made possible today. So I think we're going to continue to see, and also the solution, it's not everything has to change, right? It depends on the application. Some applications would benefit from a certain single use or portable type setup. And other instances, you might need something more robust, more stable, and multiple use is fine as long as cost is not prohibitive. So I think it's a mix of all of this. I think, in healthcare, we've kind of been pretty guarded in not exploring these options. But I think it's a matter of time, right? Just thinking about why I got into this whole digitization roadmap. Because if you look at all these other industries where automation and AI and robotics got employed, you look at industrial, look at automotive, you see certain trends. Cost went down, productivity went up, and quality went up. But now, if you think about the application of robotics in surgery, that didn't happen. Cost went up. Productivity stayed the same or didn't make any difference, and quality didn't quite make a difference. But we accepted it because that was the technology that we had at hand. But now I think we can change that paradigm. We have already demonstrated that you can leverage robotic manipulation and reduce cost or be equal. Without increasing cost, you're adding technology. So I think that is one of the primary drivers for us, is saying, how can you improve quality, how can you lower cost and improve workflow efficiency while adopting new technology, and which we can do. And I think that's the kind of one of the journey elements that we are on, is to make that happen. Because once you do that, now you're really democratizing technology to some extent, where you're going to have much broader adoption over time. You and I are fans of aviation. Yes. And it's funny, aviation tends to come into the conversation at robotics with autopilot, giving up control, advisement, leveraging of information data sets. But there's also a term in aviation when you go out and buy yourself your first airplane or so, it's like right equipment for the right mission. Yep. Does the industry look at the market as too much of a monolithic market? Like, can intuitive solve everything?
Can a census solve everything? Or do you see it becoming a right equipment, right mission environment?
I think it would be. I think there is going to be certain procedures, certain health system preferences, certain types of patients, etc., that would determine what is the right tool for that patient and that surgery. I think currently, I don't think there's many people looking at it that way. It's saying, okay, if I invest in a robotic surgical platform, it needs to do multiple things, multiple specialties and things like that. I think that's the current assessment for the most part. But I think in the future, I think we need to break that down, saying you can have multiple robots for doing different things. For example, if there is a robot, if there's a technology, digital or robotic technology, that is very specialized for certain highly complex surgical procedures, then even if the cost of using that technology is high, I think you can justify a return because it's a complex, high-risk procedure. But you don't want to apply that same technology to routine, high-volume surgeries where you can use a different technology for the high volume, which caters to a high-volume procedure, lowers cost, and also if you want to talk about mobile kind of thing, yeah, there might be ASCs and other surgical environments where a smaller footprint, smaller payload kind of a device works better. So I do think we should start thinking about this space, saying there are going to be multiple players over time. And each player will have a certain specialty. And yes, they'll be able to have other procedures as well, but they'll end up being a focus and then pan out.
I know building a robot that gets cleared and works well,
Yes.
and has features and benefits like Senhance does, is incredibly complex interaction of so many technologies. Do you ever see or forecast in the next decade where the UI and UX and the digital capabilities and the console itself becomes independent of the robot as the slave, and where it's a permeable barrier where you might slide it into another robot because the real value isn't necessarily in the telemanipulation, it's in the gathering of data and the insights gained and the advisement to the surgeon. Is that a world that we might get to see?
I think so, to some extent, because I think interchanging technologies become very complicated from a regulatory point of view and a safety point of view. But I think when you think about the scale of innovation, I think you're going to see a lot more on the softer side, the user interface and the machine learning and things like that. We are going to see significantly more happening there, and those can be done significantly faster than the time it takes to build a manipulator, for example. So I think that's one part. I think the second part is there is still a common thread about learning algorithms, machine learning, etc. It doesn't matter which platform that data was acquired. It could be handheld laparoscopy, or it could be another platform, but there is learning to be insights to be extracted from that data that could be used to train any other platform. But obviously, you need certain standards and things like that. But I do think it's not too far out where the learning can happen independent of platforms, where you could have certain data sets and libraries and things like that that the broader community can
and that's
use.
where I was going with this, right? So the data that you capture, the fidelity, the depth of data, right? It helps train that algorithm and refines it and expands capabilities.
Right.
So there's argument to be made if we're going to talk about just ubiquitous data. it happens all over the place. There are companies that get bought just for their data. And there are enormous data sets that are transferable to other models.
Correct.
So I'm just curious that once somebody has that data set, can it accelerate a robot that right now has no data set, but perhaps is a more competitive, superior telemanipulator for whatever that form factor is? And then you start to see this joining of data and insights down the line. So why not think that broad?
No, I think it's possible, but again, so many layers, right?
Yeah,
so how the technology is layered in, and how you can interface with all the different data sets. So any system has to be architected in a certain fashion in order to leverage that. But I think we're not too far away from being able to do that. And the more that we build technology leveraging standards that exist, whether it's commercial or aviation or automotive, I think the faster the innovation cycle will be, because these are regulated environments, in especially aviation, and these have been gone through regulatory rigor. So I think the more we generalize and use existing standards, it will definitely help speed up what we can offer in the surgical space.
Hopefully it's not as constraining as the aviation oversight, because you and I know that you can't even swap out a seatbelt clip on a plane without having the FAA come in for obviously good reason. And we want to continue to move medtech and accelerate it forward. So 2022 was a pretty good year for you at Ascensus.
Yes, I mean, so far we've done extremely well in terms of growing cases. We've had several additional placements, and most importantly, the team as well. I think the team's doing an excellent job in solving several things that are futuristic, and kind of coming up with very creative ways. Because what we're trying to do doesn't exist today. So it's easier to follow, but what we're doing is pretty unique. And I think looking at everything, the team's made great progress on the R&D front, and even on the commercial front with the cases, growing very healthy double digits. I think we're very pleased with how things have come along.
Great. What do people get wrong about Ascensus right now that they may want to spend more time to investigate in order to get a better signal on what you're currently doing and what you will be doing in the near future?
I think it's really trying to understand where this whole space is going, call it robotic surgery. I think robotic surgery is changing, and we're going to see a shift from the analog robot to digital surgical practices. I think that's where our focus is. We know how to build a robot. We know how to make a robot perform safely, effectively, reliably. Now it's about the digital part. So I think as a market as a whole, still the focus is on robotics, and how does it compare with the mainstream product. But I think that's kind of what we're trying to continue to do, is to educate the market around what's next, what comes after robotics, how is this space going to evolve, because that's where I think the opportunity continues to be, and that's what we are primarily focusing on, is what's beyond the robot.
You and I are technologists. Well, you're a bigger technologist than I am, but I'm a nerd and an engineer. And I agree with you there. I'm just wondering, do the hospitals have that luxury right now? And do the surgeons, and there are a few that are cowboys and cowgirls, are they brave enough in a large enough mass to help be that early adopter, overutilization, to pull the rest of us through?
Yeah. I think hospitals, believe it or not, are onto this already. Several hospitals are talking about data. They have programs within the hospital about data collection, tagging, and things like that. So some hospitals are on this journey, but they don't quite know what to do with it, but they know there is value in doing so. So that's very refreshing. We partner with several hospitals on the data front, and these are easy conversations to have because they see it. So it's not as backward as we would think. I mean, hospitals are actually ahead of this with the data front. But now it's kind of what we need to do is to say, how do we partner with them? How do we bring that to reality and showcase, take some small steps to demonstrate what this data can do in order to make it mainstream.
What do we, or what should we be looking for in 2023 and 2024 out of a census?
I think moving forward, I think the more to see is really trying to get some of these apps, taking some of the features and building procedure-specific applications where we'll be able to showcase to the market about how is this going to change. Because I think when you see a real example and you see some real publications and evidence saying, oh, we never thought that the outcomes could change or productivity could increase because now the only variable is the addition of certain digital elements. So I think moving forward, that's what we're going to attempt to do more and more of in trying to build applications and then collect data, publish, so that the real clinical value can be demonstrated and differentiated. It's not the traditional publication where you're looking at length of stay and blood loss, and that's the classic model. I think there are things to look at, saying, variability, surgical errors, complications, consistency, predictability of outcome, things like that, never kind of really mainstream metrics can now be brought to light because there are tangible ways of performing the procedure more as a science versus as an art.
Well, that's a huge competitive advantage for you right now because, again, other than Intuitive, there's no other cleared robot on the market on the soft tissue side. So you're able to continue to compound that competitive advantage. So it's going to be tough to catch you if I'm a robot that's trying to come to market or even go through V&V right now, right? And then get cleared and then start adoption and utilization, et cetera.
I think that's I agree. We believe we are way ahead of the curve in the digital side of surgery. And the results are to be seen. And so there's nothing to show in mainstream yet. Like I said earlier, we're building the foundation and now the apps will follow. And when the apps start to come and when you see the data and the comparison of certain cohorts of patients and surgeon performance in the analog world and in the digital world in the future, I think that's when things are really going to, your flywheel analogy, that's really when things are going to pick up. So that's what we are gearing up for, but it's a bit of a slow process having to kind of do this on our own to some extent. Yes, we partner with a lot of surgeons and institutions to do it, but it's a time, it's a function of time.
And it's a big commitment. This week I had a surprise. I woke up, where was I? I was somewhere in the world. And somebody called me and said, did you see the acquisition that J&J just made? And of $16 billion of Abiomed. And I think of the battle that you're in the midst of, the census right now, and Mike ran into that with Abiomed and the Impella device and just never took his dogged grip off of clinical evidence and not going after data that was convenient for an intra-aortic balloon pump to go after, but over that which really benefited the patient. And never ever lost that focus. And I feel like that's sort of the focus that a census has right now, is you can measure stays and outcomes in your own data that serves you, but let's really go forward as to where we should be going.
I think that's the piece. Like, when you think about laparoscopy, it made a huge difference for the patient. Less pain, better outcomes, less infections. Patient was able to go back home sooner, and that changed the lifestyle overall. But I couldn't say that about robotics. It didn't change a whole lot compared to laparoscopy. Laparoscopy still remains the gold standard. And what we are trying to say is that that can be changed. I think it will be changed through software driven algorithms. Outcomes have the potential to be improved over time. So I think continuing to focus on the patient outcome, improving the outcome, reducing complications, reducing the variability based on the surgeon skill level and different parts of the world, different techniques. I think all of these can be normalized to get the best outcome for the patient, which is just a matter of time. So I think it is our focus, and I believe that with this digital technology that we will be able to deliver on it before too long.
It's always exciting, and I always enjoy our conversations. Thanks for coming to my house this time.
Thank you, Joe. Thanks for having me.
Always.
Great.
Thanks, Anthony.
Thank you.